If you work for RWJ EMS, the likelihood is in the next few weeks you'll receive a ballot in the mail asking you if you want to join a union. You should know that while Mr. Smith has publicly stated joining a union is a personal choice, management has filed a legal opposition challenging our right to hold an election and your right to have your voice heard. Even if you're against unionization, you should still be bothered that management's trying to suppress your opportunity to vote for yourself. Management has also stated that the process so far has been a, quote, distraction and something keeping them from their important work. I disagree. I believe having not only the ability, but the right to negotiate our safety and working conditions, our benefits, wages, terms and conditions of employment with our employer isn't just important, it's vital, particularly with what we've seen during this pandemic. Admittedly, when COVID started, we slowed our efforts a little bit to try and not take away from the important work that they were doing. However, pretty early on, it became clear that their definition of important work and ours differed. I think it was 7 weeks into the pandemic when our executive director, Mr. Chebra, at a town hall meeting was already discussing t-shirt design and challenge coins. The disconnect became pretty clear that they actually think this is going well. And we need a voice now more than ever, because without it, the only thing we're going to hear is the sound of them high-fiving each other. Since I'm the one that's been distracting them, I feel like the least I can do is explain to you why I feel that you should vote yes. Before I get started, there are some challenges doing something like this. First, I'll stipulate management makes better videos than I do. This is video 1 of 3, and while the final 2, they're more targeted and specific, this video is more of a shotgun approach covering a lot of topics, and I've done that on purpose with the intent of getting you guys talking. I'm going for content, not special effects, and if you saw who my video team was, you'd understand. Secondly, I need to try and get a message out to 1,100 of you spread over an enormous geography. This would be a challenge even if we weren't in a pandemic. Getting information out isn't easy when the labor relations forum of workplace is moderated by administration who has the power to block my posts and filter my comments when they don't fit their narrative. The third challenge is management is very well prepared and very well funded to fight me. In addition to unlimited financial resources, they also have a very accomplished, very well educated, and very large management team. They even recently hired a 6 Sigma Black Belt certified Director of Organizational Effectiveness. I don't know what any of those words mean. I don't have any Sigmas. I'm just someone that works here who's been taking some notes. Another challenge is you guys. There are a lot of you. Some of you remember when I started this a few years ago and they hired an anti-union consulting firm to come in here and hold classes about why you shouldn't join. Some of you may be new enough. You don't even know that this push for unionization is occurring. If you missed the consultants, don't worry. I think they're going to come back after this video. Regardless of what location you work out of, whether you're full-time, part-time, per diem, whether you're an old-timer or a new hire, whether you're well-versed in organized labor or you know nothing about it, the first and most important thing that you need to know about trying to start a union is that they really don't want you to have one. And it's not just because, according to the most recent government data, union workers make 19% more. Barnabas Health is a multi-billion-dollar corporation. They could pay you 39% more and they would never notice and you'd probably still be underpaid. They don't want you to have a union because they don't want you to have a voice. Today I'm going to explain to you some of the reasons why. The final challenge is brevity. I'm long-winded and there is a lot to talk about. I was advised that I should use my time to address some of the misinformation management's put out, like you can't be on a volunteer fire department if you join a union, or to explain how we came up with a dues structure that's both fair and representative of our per diem employees, or talk about how Jersey City plays into this. I'll get to all that. I'm not gonna have time for everything today. Since this is already longer than a TikTok video, I've probably already lost 40% of the audience. I need to get the most bang for my buck, so I'm going to focus today on topics that apply to all of us. Workers' rights, which include sick time, FMLA, and workers' comp. Then we're going to discuss how the pandemic's going so far in terms of PPE, testing, operations, and something I call mutual accountability. Sick time. You should understand that when the pandemic started, this management team had just implemented one of the harshest, most discipline-heavy, anti-employee sick leave policies I've ever seen. One EMS attorney and industry expert described our sick leave policy as, quote, the most regressive, punitive sick leave policy I've seen in 30 years of EMS law, and I've reviewed quite a few. I would not want to work for an organization that approaches sick leave like this. At the beginning of the pandemic, I surveyed 200 employees and found that 84.1% stated they were less likely to use sick time when they were sick out of fear of discipline. So when the pandemic started and we were told to stay home and quarantine at the first sniffle, we had a situation where we had hundreds of employees who came from Monarch who had no sick time. And of our employees that did have sick time, almost 85% were too afraid to use it if they were sick. Early in the pandemic, administration published the CDC COVID-19 guidelines for EMS. Included in those guidelines was the recommendation that agencies develop flexible and non-punitive sick leave policies. I asked about this and I was ignored. I continued to ask and was ignored over and over again. Eventually they stopped ignoring me, but only long enough to turn off commenting. I wrote to HR explaining how this policy will endanger ourselves, our coworkers, and our families and our patients. I was ignored. I wrote to Jim Smith, and I was ignored. I wrote to the policy subcommittee, who agreed with me before they ignored me. I wrote to Mr. Ostrowski, our CEO, and was ignored. Finally, I contacted a segment producer for ABC News. Only after she contacted corporate for a comment, and miraculously, 12 hours later, we finally adopted a non-punitive sick leave policy. Regardless of any policy, you need to be familiar with the state's new sick leave laws. Despite our HR rep Hillary erroneously telling me that the New Jersey sick leave law doesn't apply to us, it does. If you look at the frequently asked questions packet put out by HR under "Can I use sick time to care for my children?" it states, quote, in certain cases, you can use sick leave to care for a child and to please speak with your manager. Why wouldn't I speak with HR? Whatever. You have the right to use sick time to care for you or your family members' injury, physical, or mental health. You can also use sick time to attend a child's school-related meeting, conference, or event, or to take care of your children when childcare or school is closed due to an epidemic or public health emergency. The union will tell you that you can use sick leave not only for yourself and your children, but anyone else that you're blood related to, or anyone else who your association with that individual is equivalent to family. I understand that sick time leads to staffing issues and overtime, and I also understand that discipline may be warranted on a case-by-case basis. If you've been sick for 2 days and wait until 10 minutes before your shift starts to call in sick, you should be disciplined. If you call in sick and go work your per diem job, you should be disciplined. If you call in sick and then show up at a Tough Mudder that we're providing EMS coverage for, you know who you are, you should be disciplined. I've been arguing this for years, and my position has always been the same. You should not be disciplined for using your sick time appropriately when needed, and that any policy that discourages employees from utilizing sick leave for fear of discipline will not be tolerated. FMLA. FMLA is an Employee Protection Act. It does not provide you with paid time off, compensation, or benefits. It simply states the employer must hold your position unpaid for 12 weeks for significant medical reasons or for the birth or adoption of a child. Here's what they don't want you to know. You cannot be forced to apply for FMLA, and HR knows this. They'll never actually say you're ordered or required to apply for FMLA, and since they can't say that, they'll say other things like you're required to contact the leave office. They'll mislead you and scare you into thinking you have to. If you're out for X number of days, you'll be told to contact the, quote, leave of absence department. The leave of absence department is not a department. It's a phone number for a contractor called FMLA Source, who's the hospital's FMLA administrator. If you don't contact FMLA Source, HR will repeatedly send you emails and text messages, and if you ignore them like I did, you'll even get a certified letter saying, our records indicate you haven't applied for leave. It is our policy to contact the leave office. Regardless of these tactics, you do not need to apply for FMLA, and if you have sick time on the books, there's probably no reason to. In the past, employees would apply for FMLA even if they had ample leave, simply as a form of protecting themselves from being disciplined. Courts have ruled that that this amounts to a form of coercion, and employees shouldn't have to exhaust their FMLA rights solely for fear of reprisals. And truthfully, they shouldn't be disciplining you for using your sick time appropriately. Despite HR implying that you'll be disciplined if you don't apply for FMLA, the Act itself states that no employee shall be disciplined for exercising any right provided in the Act, including the Act itself. Furthermore, the Department of Labor FMLA website has a section about non-compliance with employer policy, which specifically lists the consequences if you fail to return a completed FMLA packet. That consequence is they can deny your FMLA leave. Okay. If you find yourself in a situation and you're unclear or you think I'm mistaken, just simply ask your boss, are you giving me a direct order to apply for FMLA? Workers' compensation. To clarify, many people think that workers' compensation is a matter of where your pay comes from when you're hurt. Not quite. Workers' compensation law provides you, provides the employee with a guarantee of medical care and treatment for work-related injury and illness. When the pandemic started, I began asking if it's considered workers' compensation if we get COVID. I started asking, and just like the sick time thing, I was completely ignored. I learned New Jersey had a new workers' comp law that designated us as first responders and presumes that our COVID illness is work-related. I was told by one lawyer this law was so new, corporate may not even be aware of it. Obviously, I let them know and continued to ask. After more than half a dozen emails, the head of corporate care finally wrote back to me and stated that if you developed symptoms or tested positive and, quote, worked a shift in the past 14 days, it would be considered workers' comp. This seemed reasonable and within the confines of the law. Since I finally got an answer, I replied and asked if it was okay to share this information with my coworkers who undoubtedly would want to know this information. Corporate care replied by stating she would defer to Hillary and Jim. Hillary wrote back stating that, quote, leadership was putting something in writing and they will share soon. If you don't remember seeing that statement in writing, you're not alone. At first we couldn't find it either. Eventually, I think I did. One of the 6 times someone asked a question about this, Mr. Smith commented on someone else's comment and stated there. So I guess that was the statement they were working on. Luckily for us, and thanks to the benevolence of the firefighters union, the workers' compensation laws were changed and designated us to be public safety workers. The other change in the law also provides a presumption of compensability if the worker can demonstrate an exposure to bodily fluids or can demonstrate a potential exposure, including airborne exposures to serious communicable diseases. They don't want you to have a union because a union will tell you that if you tested positive, you need to fill out a workers' compensation form. A union will tell you that you should do this even if you didn't get that sick or symptomatic, since we have no idea what the long-term effects of this are. A union will show you how to keep that claim open so you have medical care even after you leave employment here. I've gotten phone calls from medics who said that they were told their COVID isn't covered by workers' comp since someone else at the same station they work at also had COVID, so it's more of a community exposure. What? Listen carefully. Whether you agree with me on unions or not, it's fine. Ignore everything I say, but listen to this. If you've been dissuaded from filling out a workers' compensation claim, or if you've been told that if you fill one out, it'll be denied, or if you have filled one out and it was denied, I strongly suggest that you contact a workers' compensation attorney. And if you don't have one, contact us and we'll put you in touch with ours. Now that workers' rights are out of the way, let's talk about the pandemic and show some other reasons that they don't want you to have a union. One thing they probably didn't consider when they hired 1,100 of us is they hired 1,100 of us. We represent what has to be the largest department of a multi-billion-dollar corporation. And when those 1,100 voices become one, you can't silence it by turning off commenting. At the beginning of the pandemic, management held their first and only town hall meeting at the end of March. I say first and only because it was a true town hall style meeting. It followed the Facebook Live format so we can all see what the other was commenting and like or react to it. And as you'd expect, management was getting clobbered. Jersey City employees were begging for more units. People were complaining they don't have PPE and face shields. We're not being told if our patients are positive, and so on and so forth. If you watch this town hall meeting, it became clear immediately that number one, they would never hold another town hall meeting like this ever again. And number two, regardless of where you work in the system, whether you chose to work here or we absorbed you, north, south, whatever, we all have the same issues and the same concerns. And if we started voicing those concerns together, they might have to listen. Well, I've been listening and we have some concerns. Testing. Let's be clear. If we had a union from day one, we would have been jumping up and down demanding testing. In March and April, when we were afraid to walk into our houses or to hug our children, we would have been demanding testing as often and as frequently as possible. If factory workers and police officers and teachers were being tested, why weren't we? The truth is, and we'll get to agency-wide department testing later, but they failed so badly at testing, they couldn't even test us when we were ill. I got COVID when COVID was scary and bad, and I did exactly what they told me to do. I emailed COVID-19 self-quarantine. They told me to contact my private physician. I called around to corporate care, who told me to call employee health, who said we're not seeing patients because of the pandemic, and to call corporate care. Contacted 18 phone calls and emails, 3 days. 2 supervisors, they didn't know, and I'm not blaming them. I'm blaming their bosses for not having a plan and letting them know what it was. We should be getting tested all the time, yet we're almost a year into this and we've done it once. RWJ, the Goliath of cutting edge academia and medicine, and this is the best that they can come up with, a less accurate spit test 7 months in. And we wanted testing. When testing was announced, that announcement shouldn't have only been welcomed by the staff, it should have been applauded. But it wasn't, because management did it in the only way that they know how. Threatening with an undertone of threatening. Mandatory testing will begin. This is a condition of employment. That condition of employment also came with 2 waivers that needed to be signed. The first was a general waiver for COVID testing, like the rest of the health system signed. And the second one, which only we got, it was a waiver that was valid for 1 year, where we were supposed to sign authorizing Robert Wood Johnson to film, record, and tape my care. It stated that I would pay for any uncovered services. I'm allowing collection agencies to robocall me. It also gave Robert Wood Johnson, for a year, access to the pharmacy records of whatever pharmacy I use, including records for medications that might treat HIV, mental health issues, and STDs. PPE. I can make this entire video and 5 others and only speak about PPE. The truth is, if you were here, you know. You know how at the start of the pandemic, 70% of employees surveyed said they'd never been fit tested. You know that over 80% surveyed were buying their own PPE. You know that management was giving us brown paper bags, safety glasses that said not for medical use, and at the same time telling us not to use our own PPE. We're 9 months into this disease where the first sign is fever, and just now we're just starting to get thermometers on the trucks. And of the thermometers we've received, what did we do? We gave them to ALS. BLS is handling 90% of this. This is on their shoulders. Let's give it to ALS. Who's making these decisions? I'm running out of time. That's a good segue to operations, Mr. Ruffino's department. I would say normally in an organization with strong organized labor, safety issues are rare, and a union shouldn't have that much to say about a department's operations. If the union were in place now, we would have plenty to say about this department's operations, because operationally, this pandemic's a catastrophic failure. Look, I've seen a lot over the last 22 years, but I've seen some things during this pandemic I never expected to see. There's also things that I did expect to see that I didn't, like bosses, incident command, plan, something. Who's in charge? management, on a managerial level, there's zero accountability. I feel like we would have had better results if we put a community CERT team in charge of our pandemic response. They may not know the precise definitions of span of control or chain of command, but they would have realized the most important part, which is delegation of duties. Ronnie, you're the liaison to the nursing homes. Find out from them daily what their COVID census is and relay that information to personnel in the field. Encourage facility staff to contact infected patients' families and update their DNR status. Develop a plan so that facilities can bring the patients out to us so we're not walking into these places. Maybe they can meet us in the vestibule with the patient. Find out what facilities don't have vestibules and contact Saddle and Logistics and we'll get them some tents. Richard, you're in charge of hospital capabilities. Make sure every one of our units in the field knows how many patients each facility can handle. Develop a plan for when those facilities start reaching surge capacity. Maybe even days you go to the blue hospitals and odd days you go to the red and blue hospitals. Whatever the plan is, figure it out, but most importantly, make sure everybody in the field knows it. Fred, you're in charge of resources. Look at our pandemic call volume, primary unit coverage area, available resources, determine where trucks are needed. Contact the local squads, see if they're operating. We didn't do any of that. At least where I work in the central region, they got a bunch of FEMA trucks and they parked them all in the same place at the same station. And not to mention, it wasn't even a station that made sense, that's far away from a hospital or vast, like the Freehold area. They put every truck in New Brunswick 50 feet apart from two hospitals. At this point, I might as well go a little legal adjacent and address Mr. Ruffino directly. I'm sure he's seen this. I don't know what the challenge coins are going to say, but this isn't going particularly well. You're supposed to be the guy in charge. When your employees are crying on their way home from work and sleeping in their cars, and you guys are sending us Walgreens coupons and updates on Silly Sock Day, doesn't the buck stop with you? We're in the middle of a global pandemic and you haven't changed one thing we do operationally other than canceling EMS week. I know it may seem like I'm attacking you, and I understand we're in uncharted territory here and there's no playbook for this, but there's actually a playbook for this. There's literally a 257-page book that tells you exactly what to do. In 2015, New Jersey conducted their pandemic influenza plan, step by step for what to do if a pandemic were to hit New Jersey. The plan even assumed that 50% of the population would be affected either by getting sick or having to care for a loved one. It would take greater than 6 months to find a vaccine. The governor would declare a public health emergency. Medical supplies would be limited. Large number of hospitalizations and deaths. Responders will experience significant stress and require mental health counseling. I haven't seen your plan for that yet, but can I suggest a second Silly Sock Day? The plan detailed exactly what's expected of EMS, and we've done none of it. You couldn't. The plan assumes that there's an operational rank structure, a delegation of authority. We don't have that here. I couldn't even begin to guess the rank structure here or who's in charge. I don't know if it means she gets command at an MCI, but our billing lady has gold collar dress. Half the people that work here don't know who their own boss is. We're in the middle of a pandemic and we don't have a designated infection control officer. And even if we do have someone's name on a paper, no one knows who that is, so what good is it? Throughout this pandemic, we've made multiple suggestions, from PPE procurement to staggering start times, and without exception, you have ignored them. We don't have designated people for anything. When this all started and no hospital was able to procure face shields, and even if you could, they were like $7 or $8 each, I happen to know for a fact that Mobile Health Service got thousands of dollars of face shields donated, and guess what happened to them? At the time when everyone was asking for them, they were sitting in a box because your team forgot to pick them up. I also know that when we were begging for testing, Rutgers had emailed you guys offering to test us months before you started, and no one from your team got back to them. Operationally, there are plenty of things going wrong on your watch, and failures and bad practices that are endangering your staff. Of all the things that we do around here, let's talk about pronouncements. It's got to be one of my favorites because on so many levels this makes no sense. Let's forget about the fact that it's awful for PR. I don't understand why a hospital system would spend millions of dollars making trucks look like billboards only to interject them into the worst time in people's lives, but that's not my concern. My concern is the danger that these pronouncements cause to not only the general public, who we can't take care of because we're busy doing these, but also the danger, the physical and mental danger that it provides to your staff. Even before the pandemic, I expressed safety concerns to you about pronouncements. In the last 5 years, in the counties that we cover, we've responded to 5,932 overdose deaths. That's 5,932 times. Our employees have been endangered by needlessly exposing us to uncapped dirty needles, feces, vomit, urine, irate family members, and so on. That's 5,932 times that you've sacrificed our mental health by sending us to death scenes where the average age of the deceased is 25 to 34 years old. And we don't only go to overdoses. In that same 5-year time frame, in the counties that we've covered, responded to 254 hangings, 152 self-inflicted gunshot wounds, and 123 jumpers. And if you think that those numbers aren't staggering, those are just the youth and adolescent suicides. But if all of this wasn't bad enough, and it is, you're having us do COVID pronouncements with no staff, inadequate PPE. You're sending us into COVID units of nursing homes to do pronouncements for a $65 reimbursement. Shame on you. I can assure every person listening that if a union was in place, we would not have gone on one pronouncement during this pandemic, and doing them at all in the future after the pandemic would only happen after meeting with the Police Chiefs Association and the medical examiner's office, and we would figure it out from there. But those are meetings I'm assuming you've probably never had. And Mr. Rufino, if these pronouncements are so important for the company, why aren't you doing them? You're very quick to implement the one medic, one EMT waiver, but what about the other waiver? What about the one that says you don't need a fully licensed MICU to do pronouncements, and basically any manager with a monitor and the Uber app can do them? The managers at JFK do them. How many have you done? How many houses with 5 positive family members did you walk into to pronounce somebody? How many COVID units of nursing homes did you walk into and there was no patient? I could be wrong, but I'm going to assume not many. And I'm going to assume that because although you're in charge of this operation, I haven't seen you or a member of your team once. I consistently work the maximum allowable shifts per week in the region that you're in charge of, and I've never seen you once. Not on one call. How do you justify them giving you a take-home response vehicle? Carry your ego? Because I check on my friends on Hotzola, you're not a member. I don't get it. I have not seen you on one call. I have not seen you at one hospital. I haven't seen you at one station. I haven't even heard your voice on the radio, not that I would even know what your call sign is. And I know I keep referring to you guys as management, and at some point you guys started calling yourselves the leadership team. Management is something that you do. Leadership is a quality that you may or may not have. If you want to be leaders, then lead. Put your employees first, stop these pronouncements, and stop needlessly endangering us. We don't need a union to hold a vote of no confidence. If tomorrow I put the question out to all 1,100 of us, yes or no, do you have confidence in Mr. Rufino's ability to safely and effectively lead this organization? What do you think those results would look like? I don't know either, but if these practices don't stop, I'm willing to find out. And this brings me to the last topic of mutual accountability. We're expected to do our jobs 100% correctly, 100% of the time, but when we ask for accountability from our managers, you simply turn off commenting. If we're expected to know our jobs, shouldn't you guys be required to know yours? If you look back at that first and only town hall meeting I referenced earlier, the one where we could actually see each other's questions and comments, not just the comments that fit management's narrative, do you know what the most common concern was? The thing that was brought up, lo and behold, above everything else by multiple staff members multiple times. When are we going to start being notified if our patients are positive? It shouldn't be that hard. The patients are getting tested when they get to the hospital. All the other healthcare providers are being notified, just not us. Mr. Rufino, your team assured us repeatedly that you're working on it, putting a team together. I presume your best people. At one point, you said that a procedure would be in place in the next few days, but that we should be patient and understand it may take longer for patients that we transport to hospitals outside of the RWJ network. And fair enough. I wouldn't want to put blame on management for anything that they didn't have control of. Let's focus solely on patients transported to our hospitals. Where are notifications? You said it would be a few days back in March. That was a full-term pregnancy ago. I have not been notified once. I don't know anybody that's been notified. You said you were going to do it and you didn't. Where's the accountability? Do your best people's evaluations, are they going to reflect this year that they were tasked with notifying us if we transported these patients and yet they failed to do so? No one from your team could figure this out. This is the problem that bested you guys. If that imaginary CERT team was in charge of this, I bet they would have figured it out. It might have just been names on the back of a rig check clipboard, but they would have figured something out. All we've heard from your team is crickets. And while I'm on the subject, I may not be Tri-Lambda Street Fighter certified or whatever it's called, but I'm pretty sure you can't deny our workers' comp claims based on the fact we didn't report the patient had COVID when you refuse to tell us if the patient has COVID. When your team meets later to try and figure out how to fire me for making this video, perhaps before you leave the room, can you also figure out a way to start notifying us if our patients are positive, and if not, maybe fire some of the other people in the room? Hillary, our mobile health HR liaison, you demand accountability for us. I've been summoned to HR many times for questioning, presumably for the purposes of accountability. Who are you accountable to? On several occasions, you have given myself and my coworkers information that's just plain wrong. I asked you if I had to go to employee health to get cleared if I used 3 days of sick leave for my daughter. You told me in front of Deanna that I'm not permitted to use sick leave for my kids. Human resources is your job. If we need to know ours, shouldn't we expect that you need to know yours? I know what happens to me if I violate HIPAA, but what happens when you do it? What happens when 2 weeks ago when you emailed one employee and you accidentally included the positive COVID results of other employees? Is there any accountability there? Will that go in your evaluation? And while I'm on HIPAA, the fact that if you work here and you get COVID-19, they're actually writing COVID-19 next to your name on the schedule for all 1,100 of us to see. Look, I'm not saying that these are D- administrators, but this is some D- work. Still, there's no mutual accountability. Mr. Chebra, you make it seem like you're Mr. Accountability. You recently sent a video, we need to get back to business as usual and back to discipline. I was recently on a call where a mistake occurred that resulted in a patient's death. I reported it and I was told it'd be investigated and I'd be made aware of the findings. I never heard anything, and lo and behold, a few weeks later on a different call, the same mistake occurred and once again the patient expired. I reported it and you told me not to fill out a Verge report because, quote, I'm not a supervisor. And my lawyer was very clear to me that I need to be very clear. I'm in no way accusing you of not filling out a Verge report. I'm just saying that I'd be very surprised if you did, since no one's ever asked me anything about either call. I assume if I went on a call and told BLS not to report child abuse because I would take care of it and I didn't, I might have some explaining to do. And look, all right, this went way longer. To close this, I have no fears that this vote will pass. This administration's management style has been far more powerful of a recruiting tool than anything I could ever say or do. I'll just conclude by saying that when you receive your ballot, if you vote yes, I'll give you a voice. But if you vote no, the only voice you have is